definitely there are around 50% of our 40 to 50% of our patients maybe in clinical practice, but overall studies which we see overall, if we look at all the trials, so the number will come around 30-35%, I would say, patients who have type 2 diabetes. But there are studies which have clearly shown that whether the patient is diabetic or non-diabetic, the benefits or ARNI will stay in heart failure treatment despite the presence of diabetes. And even if the patient is diabetic, if we are adding ARNI as compared to ACE or ARBs, it has been shown that they decrease the requirement of insulin also. They make the patient metabolically more favorable, and they also reduce the requirement of oral anti-hypoglycemic agents. So we can see the same thing here. This is the Tremendum heart failure registry. These are the data from various registries, and overall prevalence of diabetes we can see is around 30%, and prevalence of heart failure with reduced EF in diabetes, it is around the diabetes patients, the prevalence of heart failure in diabetic patients per se in 10 to 30%, and prevalence of diabetes in heart failure is around 30%. So these are subgroups of the paradigm HF trial in diabetic and non-diabetic patients, shows almost similar benefits. And it shows that glycemic control is much better. Patients on ARNI, there is a decrease in the HbA1c levels in patients who are on ARNI as compared to those who are on ACE inhibitors. The new use of insulin is decreased by around 30% with ARNI as compared to enalapril. So it is huge numbers, just show how metabolically better this molecule is as compared to ACE inhibitors, and fewer patients need start on a OHA therapy when they are put on ARNI as compared to ACE inhibitors. So definite benefit in diabetic patients, equal or even better benefits, and it also improves the metabolic health.